The issue of co-payment by some healthcare providers to national insurance card holders remain a major concern in the health sector. Patients have been billed for medication and treatment of some common diseases covered by the National Health Insurance Scheme, which government has described as unacceptable. The health minister has come under criticism after cautioning the caregivers against the practice. The executive director of the Christian Health Association of Ghana, Chag, Dr. Peter Yeboah, who sought to justify the act, insists service providers need to be operational and survive.
Without appropriate capacity, the providers will not be capable in providing the type of services that are needed by the people. So naturally, when there are delays in payment of validated claims, delay has consequences, unintended as it is. It means that providers will have to survive and thrive. And survival mechanism could be any other thing that you describe to ensure that anyone coming into the system will have access to quality, affordable medicines. It is not the intent by any way, any means to undermine the National Health Insurance Scheme. So in order to really address issue of equitable access, let us ensure that service providers are paid on time, paid with economic rates. In that case, there will be that moral and legitimate obligation and expectation thereof to ensure that service providers are capable of fulfilling the contract they've signed with NHIA.
The National Health Insurance Authority, as well as the Minister of Health, on recent platforms announced that healthcare facilities had no right to engage in the illegality since they currently receive payments of claims on monthly basis.
Co-payments have been banned. We set up health insurance targeting the very poor so that they can have access to health. So if you begin to charge them when you shouldn't charge, you create a barrier against access. Those that you are charging are getting the feeling that the thing is not working. Meanwhile, that is not the case. And even if at all, we are paying you small every month.
But Dr. Peter Yeboah disagrees.
The design of the payment mechanism will mean that NHI is always in arrears. In that case, there are still gaps in capacity, gaps in procuring medicines, gaps in doing the needful in providing services. But the reality is that if service providers are capacitated by prompt and economic payment of tariff structure of the validated claims, then of course there will not be any significant challenge or speculative charging of fees or whatever it is.